Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with an extremely itchy and irritable left ear. They've been suffering from problems in both ears since, I believe, late 2022, so almost 5 to 6 months. And they picked up a couple of ear infections at that time. And they saw their GP, who prescribed some medication and advised they've got earwax in both ears. In the UK at the moment, having your ears cleaned via primary care, so via your doctor's surgery, is extremely difficult. In the part of the UK the patient is from, they are still offering ear irrigation services. The majority of the UK doctors and primary care centres are no longer offering ear care as standard treatment on the NHS. So in that respect, the patient was quite fortunate, but they had to wait several months to have their ears cleaned. They attended and had ear irrigation performed, and they initially performed it in this their left ear, but the patient still felt blocked, so they went back, and when they went back, they were told that they've still got wax that's come back and it's very difficult to remove. And they were also told that they've got earwax in the right ear, in addition to another ear infection. They were prescribed some antibiotic ear spray in the right ear, but they were advised to have their right ear cleared prior to using the antibiotic spray. Otherwise, the spray wouldn't make contact with the canal wall because of all the wax. So the patient was at the end of his tether, and it was actually the patient's mum who watches me on YouTube and advised their son to come visit me. They travelled quite a fair distance, actually. It's a 3-hour journey each way, so 6 hours in total. And the patient informed me that prior to attending, so the day before, they were binge watching on my videos on YouTube, and just to get a feel of what we do. And they were very grateful for their mum for recommending him to come. So upon attending, I examined their right ear, and actually they had no earwax in their right ear. It was just a bit of non-occluding soft wax just at the entrance of the ear. I can, however, partly understand why the doctor may have felt the ear was blocked. The right ear in particular was quite inclined. So you look in the ear, it kind of slopes upwards. Now, all of our ear canals are slightly inclined upwards, but this patient, especially their right ear, was more so. But we could see the eardrum. I did mop the right ear up as they attended, but it didn't need clearing. They had been using the Otimize, so that's the antibiotic ear spray that they were prescribed in any case, and it seems to have resolved any problem they had in the right ear. But this left ear was becoming extremely problematic for the patient, extremely itchy, and the patient reported at this moment, this is the region they felt it was really itching. You can see just how strongly adhered this skin is. I'm peeling it away. It's a thick blanket of dead skin. So just to talk you through this procedure, at the beginning there was some lateral sticky wax keratin just at the entrance, and we managed to remove that. And so the blockage I removed almost immediately, and we could see the eardrum straight away, and the patient's hearing had improved at that point. However, they still had this very thick layer of skin that was lining the whole ear canal and eardrum, so we needed to remove this for the patient. Now, I've been seeing a lot of dead skin cases recently. I had one yesterday of a huge, which I uploaded yesterday, should I say, a huge dead skin plug. So do watch yesterday's video if you're interested in watching that one. Now, this case was slightly different. It wasn't a plug of dead skin. It was a blanket, a thick layer of dead skin, just lining the whole ear canal. So I've peeled away all the lateral skin. So this is the skin that's now on the bony part, the medial part. So it did have a slightly narrow ear canal, so